Hi, this is Jamie Davis, the Pod Medic, and I'm here with Dennis Berens, who is the Director of the State Office of Rural Health for Nebraska. And Dennis just spoke here at the IRCP conference, the International Roundtable for Community Paramedicine, was the opening keynote address talking about really getting us out of the box. And I'm going to ask you to define that, because we have a lot of people that are going to be watching this trying to understand how they can break out of the boxes they're in. So what do you mean when you say that in healthcare or in the paramedic community, we need to think differently, break outside of the boxes we've put ourselves in?
I think I brought that to the group because what we're all struggling with is trying to find a model that at least seems more sustainable than what we think we have right now. The model that we have is based on a cost model. The model is based on an education model. The model is based on a number model, number of patients to provider type model. Who reimburses for what services? Back in the old days, the box for EMS was probably the mortician driving his horse and buggy, and then maybe a vehicle, and that would be the entity other than a family member or a friend that would take you to a healthcare facility, whatever that is. So in many respects, we have created other boxes along, and the challenge that we have is what is the next box that we should be creating. I suggested to the audience that it really probably isn't a box at all. The box has walls, and those walls don't let you, in effect, think outside and to create what is actually needing. And I think most of us have this gut feel that we know there's a need to do things differently. We're scared to do it differently because we don't know what the newness is going to bring. So I don't use the word change because change, in effect, is its own box. Change is pretty scary. So I talk about growth. I'm much more comfortable with a box, if you want to use that analogy, that's focused on growth as opposed to a box that's focused on change, which is just scary as can be.
When we think about providing direct care and primary care services, it's interesting as we think and shift our thinking and grow our thought process about providing care in different ways. Paramedics are uniquely situated because we are in people's homes. We see them as they live. Tell me a little bit about some of the ways you think this type of initiative can provide. What types of services do you think a paramedic service can provide in a community setting?
Let me start by also saying the paramedic has a box. And the challenge that we have is that as we created what's now being called the community health paramedic model, is that it is also a box, but it is a push to help paramedics to envision a new world in a community setting as opposed to a world that's focused inside an agency setting. So if you think about all of the different communities where we are fortunate enough to have paramedics, because in my state of Nebraska, we don't have that many paramedics, how could we better utilize that skill set? So are they busy every hour on an 8-hour shift? Or do they have additional time, and then what could we do with that additional time? We're already paying for that resource. And that's where the question about, okay, what's going on in a community? What is it that a community needs that this extra resource could actually bring to the table? They live there usually, or they understand the area, and now we need to, in effect, give additional skills, additional knowledge, and in effect, additional permission to apply. And so I don't spend a lot of time talking about scope of practice. I talk about roles. And inside the scope of practice, what roles could we tweak? Could we adjust? Could we think differently about so that additional services could be rendered to the people out there? So that in effect, we get the right provider at the right time in the right place with the right information. And the other piece that I really am encouraging paramedics, I'm basically encouraging everybody from individuals in their own homes through all the professional entities that exist in healthcare. We got to utilize the communication technology that's out there. So whether that's cell phone technology or in-home monitoring equipment, and there's a whole array of services that are really just beginning, but are extremely exciting. And so what expertise with the paramedics' present knowledge, could in effect be greatly enhanced in a home setting using telecommunication. And then if it needs to go beyond what a paramedic can do, or even what is needed by this person, and I'm thinking needed, I don't need that level called paramedic. I need somebody to help me with my tooth, or I'm not feeling very up today. So is it, can I give enough skills to a paramedic or another person who has been trained to begin to identify that these are some key signals about depression? But then, as I said in my presentation, you have to move beyond a vision to actually putting your feet down and moving in a direction to help this person get that need taken care of. So what is that? And so telecommunication will play a role in that, knowledge of what services are available. And I think the bigger issue is, can we get all of those other services out of their individual boxes to say, yeah, for this circumstance or for the evolution of this area with the different types of population, aging, whatever else is going on, we need to create a different delivery model. But that model may need to change next year again. So that's where the box idea, once I kind of figured out that what's really going on in healthcare and the issues that I face as an average citizen in this nation is because we are all stuck in those boxes. And what we need to do is, in fact, fling open those doors of those boxes. I prefer actually using a spider web model of it, because for me it's a new model of connectivity that is much more organic, because I talked about the organic models that I think we need out there.
Dennis, thank you very much. We're going to see, I think, a little bit more of your presentation and some video that we've recorded earlier in a future segment, and we'll actually link to that on this segment. But I want to thank you, and I'm looking forward to talking to you again.
Thank you, and thank the audience who will hopefully do something in addition and move outside of their individual boxes.
Thank you.